Hello again for the people who watch the recording. This is the Apply Club Health. My name is Heinrich Schwartz. I'm happy to introduce our speaker for today. We have with us today Joan Vinyets. He is head of patient experience at the Sant Joan de Déu Children's Hospital in Barcelona. I'm not sure that I said it right, but I tried. The title of the talk is Reflections on Applying Anthropology in a Pediatric Hospital. Now, the talk, you might have read that also in our descriptions, but let me quickly summarize it. Based on the work he develops at the pediatric hospital, Joan's talk aims to show the contribution that anthropology can make to healthcare innovation, to healthcare design, and of course, improvement for patients. Specifically, to fill the gap between patients and provider perceptions and to improve, of course, the experience of patients. Now, Joan has developed his career in the field of people-centered innovation, in design, in consulting, in teaching, and in research. He has extensive experience with national and international projects related to research into user, client, and patient experience. And he is applying anthropology, participatory design, and co-creation in his work. Now, as head of patient experience, he aims at improving the general experience of patients. And that includes creating new patient-centric care delivery models, implementing new technology tools and ways to communicate with patients or patient-focused programs for effective communication, empathy, and responsiveness to patient needs. He has a social communication PhD and degrees in design and anthropology from several universities in Spain and England. Now, I've known Joan for something like 18 years, which we just figured out. At that time, we both worked on a project for Intel Ireland on global aging. So that was in 2006. Then in 2012, we both helped organize EPIC Europe, one of the only European sort of branch of events that EPIC permitted, kind of. You were working at Piece of Pie at the time, a consultancy.
Exactly.
And we also worked on a couple of projects together. So with that having said, I'm as curious as you are to hear more about what a head of patient experience is doing in his role. So I'm very happy to hand over to you, Joan.
Okay, thank you. Thank you so much, Henrik, for the introduction and for the invitation. I hope it will be useful, and it's a kind of reflections that I will share today, and of course, even some examples. And let me try now to share the presentations in order to start. Okay, I think this is, yeah, just a moment. I think it's working now. Perfect. Okay, well, here to start, you can see a little bit, a picture of how it looks, our hospital. We are based in Barcelona. We are Sant Joan de Déu Hospital, so you did a good job pronouncing Henrik. Don't be worried. And here, this is the main hall of the hospital. And about the content for today, I think I would like to cover a little bit because, of course, we don't have a lot of time, but and we need some time for questions and to discussions. But the idea is I will try to cover, why anthropology in a hospital, then how we apply and how we contribute to the healthcare innovation and design and the continuum improvement. And then finally, I would like also to share some lessons learned during this journey. So to start, some facts about the hospital. We are one of the most important specialized pediatric centers in Europe, dedicated to comprehensive care for women, children, and adolescents. And when we say woman, it means pregnant woman. And basically, we do more than 450,000 children treated per year. We are part of international organization. It's the hospital. It's a university hospital. It's a private non-profit organization, and of course we have a long-term agreement with the public system. So we provide public service to all the citizens in our area, in our city, also in Catalonia, but also in the rest of Spain, and even internationally. And in the last years, the hospital had been shifting more to have a special focus on complex and rare disease. And in terms of numbers, here you can see the numbers in terms of discharge, emergencies, consultations, and also you can see the number of beds. In total, we have more than 350 beds, and it's the staff is around more than 3,400 professionals working at our hospital. So the first thing, a little bit, it's about why anthropology, and I think in our case it's very related at the core foundational value of our organization. In our organization, one of the most important values is hospitality, and it's the idea that in order to take care of someone, you need to understand the person that you are serving, because if you don't understand the person you are serving, you will not provide what they are looking for. So, and because there is this kind of core value from the foundational moment, I think this is why anthropology plays a role in our organization, no? And then based on this value, we have a very strong aim that it's, we want to try to do our best in terms of achieving the best experience for patients and families. And probably on that, the fact that we are a pediatric hospital also it plays a big role on this type of aim and approach, because it's not the same to work in, for a pediatric hospital than to work for an adult hospital. So in terms of our approach, the idea is that we want to provide the best care. And in order to do that, our idea of improvement and transformation, it's focused on people. And the idea that, patients, families, and professionals play a key role as a lever of change. And here you can see some images of sessions and workshops that we do during all the year in order to identify opportunities for improvement and how to improve our care delivery model. And I think, in terms of asking the question, why anthropology, I was mentioned because our values, because our approach. But I think for me, the most important is at the end, it's when you think in a setting like a hospital, it's completely dominated. The mindset that it's dominant, it's a very scientific mindset. So there is a common culture and mindset shared through all the professionals that it's very focused on this scientific approach. And at the end, the reason of applying anthropology in a setting like our hospital, I think it's because you need to complement this kind of mindset and vision. And at the end, I like this metaphor of the lens. I think that when we think about the value contribution of anthropology, I think for me, it's a type of lens that you bring to this type of settings and professional mindsets. And I think for me, this is one of the important contributions. So in terms of why anthropology, I feel like, at the end, when I look back at the work that we do, we are providing this more human care through this anthropological lens. And this thing about integrating the anthropological lens with the medical knowledge can provide a more holistic, empathetic, and culturally sensitive approach to patient care. And I think this is the role that we play. And of course, at the end, it's about providing qualitative research and patient insight. So our team provides insights into patients' perceptions, experiences, and needs. And this is something that it's always difficult if you only approach a patient in terms of the biomedical mindset that normally it's the one that drives our types of organizations. So in order to do that, how probably the question now is and how you do that, how you try to do that. And it's what I will try to cover now with this part of the presentation. So basically here I'm sharing a little bit, this idea that this is kind of our model of working. So you can see that we focus on human factors and in terms of understanding patients, family, and professionals. And then, there's this kind of continuum of feedback and insights for the constant improvement, innovation, and cultural change. So we are exploring and we are trying to explore and identify patient experience, pain points, and latent needs. And then we try to bring these insights into our integrative care model. So this is the way in which we are improving our integrative care model. Based on these insights, we can fine tune, we can change, we can improve, even we can innovate some of the dimensions that our care model is trying to cover related to different human needs. And these different human needs are needs that, it's not only the biomedical needs, but it's in terms also of sometimes more spiritual, more social, or even more psychological. And this is the type of work that we do. So at the end, it's a kind of this loop, this continuum of insights, because of course, every time that you bring new insights to evolve, to improve the integrative care model, then of course, there will be new needs and new insights coming because the type of care that you are providing. So this is a little bit the idea. And in doing that, we are applying the methodologies that nowadays are very well known, the design thinking approach, the double diamond approach with this idea of diverge, converge. And this is our kind of model. We adapted the model. And basically what we do is in all the projects, always, of course, starts with a briefing, but till the briefing it's not clear, there is no the go on the gate 0. So then there is a kickoff meeting, and then basically what we do is all the field work, understanding. Then based on the insights, there is another important moment. It's gate 1 in which we share all these insights with all the teams. And then based on that, we develop all the, to generate ideas to try to find solutions for cover and the needs and the pain points. And then, of course, there is prototyping and then follow up and reviewing the results. So it's this idea of this continuum of improvement and innovation. And basically, the way in which you approach is applying some principles that you can see here on the slide. No? The first one is our way of working always it's human-centered. So we focus on people, patients, families, and professionals. The idea that during the whole process, once we are working, always you have to keep in mind this kind of co-creative mindset. It's co-creating with them. So it's putting them, patients, professionals, and families at the same table. They are working with us. And, having this kind of empathetic approach and trying to develop always these participative methods and having this collaborative mindset. And then finally, always the idea of having this agile development. So all the process should be agile, very dynamic, with different and multiple iterations for this idea of continuous improvement. So basically, at the end, when you think our focus, I like to say that, it's from pain points to gains. This is the idea. Of course, we are interested to explore, what we are doing well or very well. But of course, our focus always it's to find the red spots, not to find the pain points, and then the idea is how we could transform these pain points in gains in value for our users that in our case are are the patient and their families. So this is our focus. And, just to give you some examples, for example, the way we work, we always work through the journey. We try to understand and explore the patient journey. And then based on the patient journey, on the different touch points, for example, in this case, no, we explore and we got some insights about, a lot of families were saying, uh, when I have my child, that at the hospital it's not easy for her or for him to wait. So I would like for my children, to move around. But of course, at the same time, I'm worried because I want to keep control. And and of course, then we transform that, for example, and this is some of the things that we develop in the main hall. So the idea that the kids, they can play while they are waiting or in the waiting areas. And that's good for them because they are more relaxed, and it's good for the parents because also they are less stressed. And here, I think, you can see this idea that how we transform these pain points in gains or in value, no? But of course, this is also in all the different touch points around the journey, also in the moment of diagnostic. So because we are a center that is focused on rare disease and complex disease, there is a moment during the diagnostic that it's very painful and could be really, really, very impactful for the families, for the sick children, but also for the brother or sisters. And this is a kind of pain point that we found in different, explorations that we did. This idea that, that um, parents, mothers, fathers, they are worried a lot about, how they will explain the situation. And especially not only thinking on them or in the sick children, but also on their, sisters or brothers. So in this case, we found that this was a very, relevant pain point. And what we did is we developed one guide. Sorry, this is in Spanish, but la primera noticia is the first news. So when the first day that they are giving me the news about the diagnostic. And here on the right side, you could see we developed this guide. We developed a training program for all the professionals in which we are training them in communication skills, how they have to communicate the notice. And here you can see that even now for the training, we are applying the simulation methodology that had been developed for the Harvard Medical School, and we apply this. So here you can see, like we use actors, professionals actors, in which we simulate one event that is happening, and then all it's recorded and there is a debriefing. So the professionals are interacting in these situations, and then they can see if they applied the right skills in terms of communicating the news. So in this case, the transformation of the pain point, it was in a new training for all the professionals at the hospital, no? And of course, another example, no, just to give you some, few examples, it's, for example, another pain point, it's during before any intervention, because, and this is something that is shared for all the, of course, for all the families, that it's always hard for, for the kid not to be angry or stressed when they know that they have to go under an intervention or clinical test. So in order to transform this pain point in again, in value here again, we develop some ideas and we put some actions in action. And for example, here you can see on the left side, you can see we are using a healthcare professional role that it's called child life. Normally, there are nurses or they have backgrounds in pedagogics, education, and they are trained in a way that through the use of resources like the symbolic games, what they do is they prepare. Here you can see that they use these these toys. They explain the intervention, and they prepare the kids before the intervention. Or even on the right side, you can see that we are also using dogs that can help. For example, we are using even when we want to bring the kids to the chirurgical room. So we develop actions based on these pain points, no? And I show you 3 examples. And then, of course, when we develop the projects, we use different tools. And here you can see a list. We have a toolkit, and at the end, it's always the same. Depending on the type of challenge that you have, the type of project, then you apply different types of tools. Of course, we apply tools from the anthropology, but not only from the anthropology, also projective tools, tools coming from arts, also, tools coming from the traditional market research, or from the creativity domains like design or art, as was mentioning. No, so the idea is to combine some of these tools in order to get the better insights. Of course, our approach is qualitative, but also sometimes we use quantitative tools when we want, for example, to see if some of the insights are relevant for a bigger sample of participants. So it's a multi-method toolkit that we have and that we apply in all the projects. No, and here also, there is always some kind of flexibility and creativity in trying to find new ways to do research, to engage with participants, and especially due to the fact that we are interacting with children. So it's not the same as doing field work, always with adults. And here's some, I wanted to share with you some pictures of interventions. For example, in this case, it was for oncological patients, and we were trying to, with card sorting images, to try to make easier to start a discussion, a conversation with them. For example, here also we've been using in other projects role playing. What happens if, for example, the kids are playing the role of professional healthcare and the mother or father is playing the role of a patient? What they tell us, what they explain, what they stress, what's important, no? So this use of role playing has been very useful in our fieldwork activities. Here you can see others. Here in this case, the idea was, okay, we have to record a short movie in which you have to explain how it works, this type of intervention. And it was really interesting what things they were stressing that we never thought about. And in this case also, as you can see here, we were doing field work with patients, but also we invited the healthcare professionals, because it's not the same to share insights, or if they are part of the field work and they can listen by themselves. No, and of course also we are exploring other ways to try to to get insights from patients. For example, we know that when we approach teenagers, we have to use other tools, other resources, and we've been playing a lot. For example, using this type of comics and storyboards that they are very familiar with, so they start to be, more comfortable, and they start to discuss things that worry to them. And the last thing that I wanted to share is that the hospital have we are so lucky. We have more than 300 volunteers, and what's nice is that during the summer there are more than 300 volunteers coming from the university, young people. So we decided, okay, why don't we transform these volunteers during the summer in our researchers? So what we did is we did some training with them, and we asked them, okay, now you have to be the anthropologists, okay? And because you will be spending all the week here, you could provide insights, you can help us to gather some insights. And even what we did, it was we developed a tool. You can see here the tool. Here you can see that we develop a tool in which they could use their own cellular phones. Here you can see a couple of volunteers. So they were recording their observations and some findings. And then, of course, also here you can see some images that we work with them to try to transform some of the pain points in ideas or solutions. So we organize workshops with them. And it was really, really a very interesting experience to have the help of these young, very enthusiastic ethnographers, I will say. So, this is a little bit about how we develop our work as anthropologists and the type of projects that we do. And, going almost at the end, because I know that we need, Henry told me, please, we need time for questions. Uh, I wanted just to share a little bit, here with this slide. Of course, this is a document that we will share later, but here you can see, different types of projects, the type of pain points that we found, and then, how we transform these pain points in project outputs. And then, of course, always something that is very important, especially in this, clinical scientific mindset, is to try to show the impact of your actions. And this is why, always we have to identify certain metrics to show the impact, to show that, we did this research, we identified this pain point, you develop, this project output, but what's the impact of the output? It been covered, it been not covered. So this is something that that it's very, very important, no? And of course, depending on the type of project, as you can see on the slide, you have different types of metrics. Sometimes it's if you identify, like it's the case on the first line, no? If you identify that there were, a lack of understanding, then of course the impact will be, okay, did you cover this misunderstanding? People understand the care team's role. So I will not go deeper on that, but I thought that probably could be helpful for you to see a little bit, the kind of projects, outputs, and impact that normally we try to achieve in these projects, no? But then, thinking about impact, and I was thinking, what's the most important impact that I've seen? And I wanted to share this testimonial from one of the healthcare professionals. She's in charge of the obesity unit, and we develop a project based on our insights. Now we are completely changing the model of care. And one day, in a very spontaneous conversation, Martha is her name. She told me, "Look, Joan, I really enjoy it working with you and your team to develop all this project. It was a project that we ran during almost 6 months." And she was saying, because your approach is helping us to take a holistic approach to care. No, and she was saying, it helped us to take into account the whole person, and not just treating this patient as a set of diagnoses or symptoms. So, at the end, when I was thinking what could be the best or the biggest insight for today's session, for me, I think it's this one. Of course, we can provide insights, but I think really the value that we provide, it's this kind of, cultural change. And I think this is really, really amazing, no? And to try to explain a little bit this, I prepared this slide because I think so many times we are focused a lot on results. Of course, with the results, I can identify certain behaviors, and and the behaviors that I've been identifying with all the professionals working with us in different projects are all these behaviors. But at the end, I think when I think on the biggest contribution and value, it's that we change them to switch, to change their mindset. And now, you know, I can see that they are more empathetic. They apply more creativity. They are more curious. They are willing to collaborate more and always trying to experiment, no? So I think for me, this is kind of a very important impact. And of course, when we talk about impact, you always think, okay, and how you value this? Well, I think it's really difficult to value this. For me, the best way to value this is through a conversation. So this brings back, you know, our essence as anthropologists. I think at the end, it's through the stories that people are telling us. In our case, you know, healthcare professionals. It's the best way in which you can see what's the value that you bring to the table, no? So I think from my side, this is all. And just to finish, I would like, you know, to share some takeaways. I think if you are planning to bring anthropology to a healthcare setting, you know, I think you have to keep in mind that this type of anthropological contribution is a collaborative work through all the organization. It's not about having an expert, a charismatic expert, or even a single special team. It's you know, it's about all the organization. Then I think also that it's important not to rely only in external experts. You might have, you know, the opposite effect, because if all the work is done by experts, then probably internally the team will think, okay, this is not about me. The other point I think it's important is that from the beginning you need to engage the right people, and then it means that in a big organization as this one, you need to have the key contacts in the organization to build this kind of internal teams and networks, and because they are the ones that will help you to spread the word. Then, of course, you need to take time with the process, and time in, you know, you have to spend time in building relationships. Of course, then you need to provide time for experimenting, sharing, and learning. And of course, also you need to convey, you know, progress. So you have to tell some stories and lessons learned to the wider community. And finally, I think it's very important that you need to manage expectation, because it will be a long journey. But I like always to finish that, you know, once it started, there is no going back, and I think that's the good news. So from my side, thank you, and I think now I will finish sharing, and I think it's time for the conversation.
Yes.
We
Thank
are
you,
on time,
Joan.
eh?
Yeah, perfect. Very
Fantastic.
good.
Yeah, really interesting.
Excellent. Joan, really, thank you so much. That's a fascinating perspective on how to improve patient experience and your work and how you go about it. And I will turn the recording now off for our discussion that we don't record. So for those who will watch this later, thank you for listening. This was the Apply Club Health with Joan Vinyets from the Children's Hospital in Barcelona. Thank you for being here.